Sandy. I'm going to be your physician assistant today. I'm doing your neurologic exam. Can you please remove your shirt, shoes, and socks and while I go wash my hands? And then wash my hands. Okay, I would perform a mental status exam first, and now I'm going to go ahead and start with the cranial nerve testing. Can you include one nostril and then breathe in and out for me? And then the other one? Okay, I'm going to be testing cranial nerve 1, olfactory. Can you close your eyes, include one nostril, and then tell me what this scent is, and you can smell it.
Cinnamon.
Okay. And then go ahead and include the other nostril, and tell me what this scent is.
Coffee.
So now I'm going to be testing cranial nerve 2, optic. Can you hold this about arm's length away, cover one eye, and then read the smallest line you can read?
3, 7, 3, 6, 4, 6.
Okay, and then the other side, cover this eye.
3, 7, 3, 6, 4, 6.
And then both eyes.
3, 7, 3, 6, 4, 6.
Okay, and then I would also measure distance visual acuity using a mounted Snellen eye chart from 20 feet away. Now I'm going to test cranial nerve 2 for gross motor concentration. So go ahead and put your arms right here, and then when you see my fingers and your periphery, point up for me. Okay. Now I'm going to test cranial nerve 2 and 3 off the motor for oh my god, wait. That's okay. It's like, why about this? Oh god, no. Okay. For direct and consensual pupillary light reaction. So I'm going to test direct in this eye, and then consensual, direct, consensual. Okay. Now I'm going to test cranial nerve 2 and 3 for accommodation. So can you look at a point on the wall? I'm going to bring this into your periphery and just focus on it. Okay. Alright, now I'm going to test cranial nerve 3 and 4, trochlear for convergence. So just focus on this pen as I bring it closer to your face. Okay. And then I'm going to test cranial nerve 3, 4, and 6 abducens for extraocular movements. So follow the tip of my pen as I move it in 6 spots. And now I'm going to do the fundoscopic exam. I would dim the lights. I'm checking the diopter and the lights. I'm going to test corneal light reflex from 4 feet away for symmetry. And then I'm going to go 15 degrees lateral, 15 degrees from the patient, and test the red light reflex. And then I'm going to be going in and assessing the optic disc and margins, cup to disc ratio, retinal arteries and veins, and the condition of the retina. So we're doing that. Alright, and then can you look in the light for me? I'm assessing the fovea and macula. Okay. I do the other one. And now I'm going to do the other eye. So I'm going to be looking at the red light reflex. Okay. And assessing this eye. Can you look into light? I'm assessing the fovea and macula. Okay. And now I'm going to continue with the cranial nerve. So I'm going to be testing cranial nerve 5 trigeminal, and 7 facial for the corneal blink reflex. So I'm just gonna pretend to do it. And then I'm gonna be testing cranial nerve 5 palpating. So can you clench your jaw? Okay, I'm gonna be palpating the masseter and temporal muscles. I'm gonna be testing cranial nerve 5 for the 3 branches of trigeminal nerve. So can you close your eyes? Okay. Just tell me what feels the same. So does this feel the same as this?
Yes.
Does this feel the same as this?
Yes.
Does this feel the same as this?
Yeah.
Okay. Now we're testing cranial nerve 7. I'm going to have your eyes closed and then try to resist me trying to open them. Okay. I'm going to test cranial nerve 7 again for facial movements. So can you raise your eyebrows, frown, smile, show teeth, puff your cheeks out, puff your lips, and whistle?
I can't whistle.
Okay, I'm going to test cranial nerve 8, vestibulocochlear. I'm going to do the whisper test. I'm going to cover one ear, and then on the other side, I'm going to say a 2-syllable word. Just repeat that to me.
Cupcake. Hot dog.
Okay. Now I'm going to test cranial nerve 9 vagus, 9 glossopharyngeal, and 10 vagus for the gag reflex bilaterally. So I would uncover this and then open your mouth, and I would do
What?
the gag reflex bilaterally. Okay. And then I'm going to be testing cranial nerve 9, 10, and 12 hypoglossal for what's this? So open your mouth and say ah. I'm looking at the symmetrical rise of the palate and the quality of the patient's voice and speech. And now I'm going to be testing cranial nerve 11 accessory. So can you resist my movement, like pushing up? Yeah, with the trapezius, and then push your head into my hand. And this side too. Okay, testing the sternocleidomastoid. Now I'm going to test cranial nerve 12 hypoglossal. So can you stick your tongue into the side of your mouth and resist my force? Stick your tongue out. Okay, I'm noting the position. I was noting the strength before. And then move it left to right. Okay, good. And then I'm testing cranial nerve 12 again for lingual speech. So can you repeat no ifs, ands, or buts?
No ifs, ands, or buts.
Good. Okay. So now that that's done, I'm going into the motor exam. So I'm inspecting the upper and lower extremities for any muscle bulk and signs of atrophy. I'm going to be testing the upper extremities for muscle tone. And the lower extremities for muscle tone. Okay. Now I'll be testing muscle strength. So we'll do arm abduction, so C5, C6, and then arm adduction, C6. We'll do elbow flexion, C5, C6. Oh, wait. Oh, sorry. C5, C6. Elbow extension, C6, C7, C8. Wrist extension, C6, C7, C8. Wrist flexion, C6, C7. Can you grip my fingers? C7, C8, T1. Can you try and spread your fingers apart? C8, T1. And then can you do this and resist my, okay, that is C8, T1. Now we're gonna do lower extremities. So we're gonna do hip flexion, L2, L3, L4. Hip adduction, L2, L3, L4. Hip abduction, L4, L5, S1. Leg extension, L2, L3, L4. Knee extension. Knee flexion. So go ahead and flex your knees. L4, L5, S1, S2. We're going to do dorsiflexion, L4, L5. Do it on this one too, sorry. And then plantar flexion, S1. 1. Okay. I think that's it. That's all. So we're going to go on to light touch sensations. So can you close your eyes for me? And then I'm going to be lightly touching this along your arms and legs. And tell me if you can feel it on both sides. So we're going to do C5. Does that feel the same as this?
Yep.
Okay, we're doing C6. Does that feel the same as that?
Yes.
Okay, C7. Does that feel the same as that?
Mhm.
Okay, C8. Does that feel the same as that?
Yep.
Okay, T1. Does that feel the same as that?
Mhm.
Okay, we'll do T4. I would do this under clothing. Does that feel the same as that? Okay. Does this feel the same as this?
Yes.
That was T10. We're gonna do L2. Does that feel the same as that?
Yes.
Does that feel the same as that for L3?
Mhm.
And then L4 does. Oh wait, sorry. L4, does that feel the same as that?
Yep.
And then L5, does this feel the same as this?
Mhm.
And then S1, does that feel the same as that?
Yep.
Okay. So now we're gonna do position sense. So I'm gonna take your, so close your eyes for me. And then I'm gonna take your distal phalanx and move it up and down and then tell me where it ends up.
Down.
And then I'm gonna put this hand.
Down.
Okay, now I'm gonna do it on your feet using the distal hands of the toe. Close your eyes.
Down.
Okay, and then this side.
Up.
Up. Okay. Good. Now I'm going to test for discriminatory stuff. So I'm going to okay. So go ahead and close your eyes, and then I'm gonna put these in your hands, and then tell me what they are. So what is that?
A quarter.
Okay, and then what's that?
Paper clip.
Okay. I know I forgot. Okay, going back. I'm going to test for vibration position sense. So can you close your eyes again? And then let me know. Come here. Is that vibration or pressure?
Vibration.
Vibration or pressure?
Vibration.
Vibration or pressure?
Vibration.
Vibration or pressure?
Vibration.
Okay. And then we already did the discriminatory stuff, so now we'll do.
I think you dropped that.
I think this D2. So we did the number. So now we're gonna do gravitation. So close your eyes and then tell me what number that I'm writing in your hand.
3.
Okay, and then this hand.
3.
Yes.
Trippy.
Okay, and now we're gonna do reflexes now. So I'm going to start with your biceps reflex, C5, C6, and I'm just going to that, and then this. Then we're doing bilaterally, C5, C6. Okay. Now we're gonna do the brachioradialis, C5, C6. Now we're going to do triceps, C6, C7. Okay. And then C6, C7 again. Got it. And now we'll do the abdomen. Reflexes, if you can lay down for me. Okay, I'm going to do the T8, T9, T10. Above the umbilicus, and then T10, T11, T12. you can sit down for me again. Alright, I'm going to do the patellar tendon reflex. So, don't let, okay, you're good. Let's do a little.
Yeah.
Okay.
I ripped all of
Okay,
these ones.
got it. And then
Yes.
we're going to do the Achilles tendon reflex. This was L2, L3, L4. This is S1. And then we're going to do L4, L5 on the plantar. So we're going to do lateral to medial, and then we're going to do ankle clonus testing. So I'm going to close your eyes for me, and then I'm going to do this. Okay, I don't know if your eyes are supposed to be closed or not, but whatever. Alright, now you can open them. Okay, now we're going to move on to, what's it called? Coordination. So, your finger to your nose. Okay, go ahead and touch your finger from your nose to my finger. Okay, now do it again while I'm moving a couple times. Okay, here. And now close your eyes, and now try to match it a couple times. Okay, good. Now you can open your eyes. Can you bring your heel from your ankle up your leg and then down? And then the other side, so up your leg and then down. Okay, we're gonna test fast alternating movements. So can you change a light bulb like this with your hands? Can you touch your fingers to your thumb? And then can you tap your feet to my hands? And then we're gonna do gait stuff. So can you stand up for me? I'm gonna be inspecting. Let's stand in front of the camera a little bit. So I'm, yeah, that way. Okay, no, this way. Okay. Okay, so I'm gonna be, can you stand with your feet together, and then just your eyes open for 30 seconds. I'm just inspecting the stance position. Then close your eyes, and then I would be inspecting the Romberg position for 30 seconds. And then can you extend your arms out? So this is pronator drift. I inspect this for 30 seconds, and then I'm checking alternating movements of the arms. Okay, you can open your eyes. And then can you walk normally, your normal beat? Okay, and then walk back heel to toe. Okay, and then walk on your tippy toes, and then your heels, and then jump up on one leg, and then the other leg, and then jump on both legs. Thank you, you're done.